to talk about astronaut mental health. I need to give you a disclaimer. This is not my specialization, but it's a little bit like my baby project. It's something that I'm very much interested in. I've been doing my own research at my own time. I've been reading a lot about it. So later during the discussion, if you feel like you want to give some input or something you've read and something you want to talk about, I'd be more than happy to discuss that. So very much open to this. There are a few new names that I see that are here today. I don't really like talking about myself, but it's important when we talk in science to know who it is who's talking. So hi, I'm Vanessa. I'm Greek American. I'm currently in Houston, Texas, where I'm doing my postdoc in space radiation protection in genetics, and I'm also preparing to train to be an astronaut soon, hopefully. And I have a background in biology, biomedicine, astrophysics, and I'm also a doctor, a medical doctor. I'm very much interested in the human body in space. So that's why we're here today. Today, we're not going to talk so much about the physical part, but more about the behavior and the mental health of astronauts. So here's a brief outline. We need to recap to see what does it mean really being in space. We're gonna do an overview of psychology and sociology that has happened until now in space. Space conditions and their influence on mental and behavioral astronaut health. We're gonna look at that. The challenges astronauts will face when they are going to the ISS, the International Space Station. What it means traveling deep in space. The concept of crew size, you're going to see how important this is, and the criteria of how we can choose our crew. Keep in mind, this is a huge topic. I am thinking of maybe we do a part 2 sometime. I'm just only going to give you an introduction of all the concepts that I think that are important for astronaut mental health. Now think about this. We're on the launch pad. We are ready to go. We have been training for this for the past almost decade. We know exactly what we are supposed to do, what we're going to do, why we're doing this, and then there's liftoff. And everything goes well, and we leave the atmosphere. And as you're strapped in your seat, you look to your left and see this from outside the window of your craft. That moment is magical. All astronauts have described this as leaving them in awe, as making them feel extremely at peace, seeing their own problems as very small, their lives, their everyday lives as not as important anymore, their struggles. The people they love become even more special all of a sudden. They understand their place in the universe just by taking a look outside that window. Actually, this is so common that it's called the overview effect. It's a cognitive shift in awareness reported by almost all astronauts during spaceflight, often while viewing Earth from outer space. Actually, Michael Collins from Apollo 11 says, "The thing that really surprised me was that Earth projected an air of fragility And why? I don't know. I don't know to this day. I had a feeling it's tiny, it's shiny, it's beautiful, it's home, and it's fragile. So you do tend to become more poetic when you see your own home, your own entire life from a higher perspective. Now your turn. Please use the chat, okay, to answer to this. When do you think we first started keeping track of astronaut mental health? In the 50s, 60s, 70s, 80s, or 90s? Ooh, very many various answers I see. Several people are saying 80s. I think that's the most common answer. But I can see everything. I can see A, I can see B, I can see C, I can see D, I can see E. Okay. So logically, one would think that before we even sent manned missions, we would think that we would prepare our astronauts, our humans going into space for their mental health, right? Well, that's not the case. Actually, we started realizing that astronauts' mental health is also just as important as their physical in the 90s, actually. So very, very late. So the psychiatry of space is really brand new. All right. So, and what do we really do to follow them during their mission? Actually, it's very simple. We ask them to keep a diary and write down whatever it is that they're feeling, experiencing, their relationship with their colleagues, how they're feeling with themselves, are they overworked, are they tired, are they missing home, etc., etc. There's also a part where they can do video logs, so they record themselves. It's a recorded diary. But it's actually quite interesting to see the results of those diaries. So in this diagram, for example, you can see the different shades of gray. First of all, they're divided in quarters of the mission. So let's say a trimester per quarter, or less according to the duration of the mission. Doesn't really matter. It's whether it's the beginning, the middle of, or the end of the mission. And then you'd have different criteria about each different category of things we can look at. For example, their fatigue. Are they tired? Well, that's part of the training of astronauts while they're still on Earth. That's why it's so important that they train well, so that they don't really end up being tired when they're up there. Here, for example, you can see their problems adjusting. Well, at the very beginning, they have a lot more trouble to adjust than later. Afterwards, they feel fine. Or it's also interesting, the beauty and wonderment, that overview effect we were talking about a second ago, that at the beginning it's quite big, but after a while they get used to being there, so it's not that feeling anymore. They get adjusted, right? Also, it's quite interesting to look at the concept of low morale, having a general catatonia, which tends to increase towards the end of their mission. So the longer they are in the ISS, the more they feel down, in quotes. All right, now let's recap according to what we saw last month. What does it really mean being in space? Whoops. All right, So what we talked about last month in great detail is the high radiation, ionizing radiation, right? Whether it is from our sun, from our galaxy, or from the cosmos, it doesn't matter. We're exposed to radiation. There's also the concept of microgravity, all right, which is actually on the ISS, it's only 38% of Earth's gravity. But it's also about being away from family and friends who are our usual support system, right? Being around strangers or colleagues all the time for extended periods of time in a confined space, in a small space, right? Now you're gonna ask, why is ionizing radiation so important on our behavioral and mental health? Well, take a look at this. Let's say that we are exposed to radiation, ionizing radiation, some form of what we had talked about last month. This exposure to radiation may affect the central nervous system functioning of the astronaut, which might then disrupt their sleep cycle, which in turn will have an effect on how productive they are and in their relationship with their teammates. So eventually we might start with something physical like radiation and end up with something behavioral, which has to do with the performance, affecting the performance of the entire team. Now your turn again. Which system in our body do you think can influence our mood? Musculoskeletal, immune, endocrinal. Endocrinal has to do with hormones. Digestive, or all of the above? Let me see you answer. Yay, well done. Well done, very good. Yes, all of the above is the correct answer. Let's take a closer look to what I mean. Okay, so if we take them one by one, of course, we can go into great detail, but we're not going to do that today. If we look at the musculoskeletal system, there is, due to microgravity, a weakness and bone mass loss that will lead to extensive fatigue, all right? Immune system, you have the bone marrow and the thymus affected. The immune system lowers itself, the barrier lowers itself, if you will. So we're more prone to infections, which can also lead us to have extreme fatigue. So fatigue is just the course from which other things stem from, which we're going to talk about. Endocrinal system, of course, hormone levels are altered. The ISS goes around the Earth every 90 minutes. That means that our chronobiology, our circadian rhythm, which knows that when the sun rises and when the sun sets, we have some particular hormones being secreted according to this rhythm. But when the ISS experiences a sunset and a sunrise and a sunset within 45 minutes from each other, then you realize that our hormones get all messed up, right? Same goes to the neuroendocrinal, whatever is secreted within our brains. And anything that has to do with digestive and genitourinary, because of the lowered immune system, we are more prone to developing things like UTIs, urinary tract infections, or prostatitis, inflammations, etc. And the whole thing just sets us to a catatonic state. What has been recorded until today for mental health? Well, we categorize them into three big categories: adjustment disorders, somatoform disorders, and mood disorders. More specifically, some examples of these: for adjustment disorders, we can have memory impairment, problem-solving issues, or even anxiety. Somatoform disorders have to do with the manifestation of the physical exposures from the mental problems with our physical body. That means having false psychosomatic symptoms, for example, feeling, for example, pain somewhere without it really having an issue at that area. Like psychalgia or extensive fatigue, they're all the same. They're false. They're not really happening, but you're still feeling them because of your mental state. And of course, mood disorders, which might be the most famous ones, like depressions, maniodepressions, schizophrenias, or psychotic thoughts. All right, your turn again. Do you think it's all negative going into space? Can you think of any example that can be improved in one's personality or character under space conditions? So we are in the ISS. What do you think would be a positive outcome on our personalities? It's not a multiple choice. I'm actually waiting for you to answer whatever comes to mind. What do you think is a good outcome from us being into space mentally? Maturity, okay. Patience, being humble, patience again, okay, great. Teamwork, discipline, self-control, understanding your place in the universe, absolutely. Understanding that there's something bigger than us, I love it. Learning how to appreciate life, tolerance, self-maintenance. All right, well done, you guys. Wow, great. Well done. That's the point that I wanted to stress, that it's not just about the negative effects on our mental health when going into space. There's also extreme occurrence of salutogenesis, so positive things that are happening to us, like fortitude, perseverance, self-growth, ingenuity, because you always have to think of how to solve problems that you wouldn't have to solve if you were on Earth. Teamwork, camaraderie, decreased depression. Some astronauts have recorded of feeling very joyous, very happy from being in space. So it's not, you can have the two extremes. You can have people that end up having depression from being homesick, for example, but you can also have people whose depression is decreased due to seeing their entire lives from another perspective, right? This, by the way, in the picture is astronaut Jessica Meyer, who's also, by the way, one of the 20 people who are going with the Artemis program back to the moon next year. And this is the cupola of the ISS, the International Space Station. That's where they are said to spend a lot of their free time. They don't have a lot of free time, but a couple of hours in a day they do have free. So they tend to go there and just look outside, basically. So it's just a small area of the ISS where it's surrounded by windows. So you have, I think we can all agree, the best view possible. And a lot of them get involved with photography. And there's a lot of books actually that were published from their photographical memories after they're back on Earth. All right, your turn again. Now, when we're talking about deep space missions, all right, deep space means further than the ISS, all right? What animal models do you think we could use to examine the effects of long-term deep space traveling, as we have not sent people yet? Which animal models do you think we would use? Again, it's not a multiple choice. I need you to throw some animals at me. So we haven't sent people. So what can we use? Drosophila. Drosophila are fruit flies, and they're very small and they die really quick, and it's not really gonna work. C. elegans, same thing. They don't really have a very advanced brain or neurological system to be able to form societies, right? So I see mice. A lot of people are saying mice. Migratory birds. Ooh, I like that. Monkeys. We're no longer really allowed to use monkeys officially. So only very few in sociological studies are they allowed to use monkeys still today. So our bioethics comes in and kind of doesn't truly allow us. Okay, Kateridas, I can see cockroaches. So cockroaches are, and same goes to tardigrades. Cockroaches and tardigrades do not really resemble us because they're so good at resisting at everything that we throw at them. So it's actually very difficult to compare ourselves to them because they're so much better than us at surviving. Reptiles, again, we don't really resemble them either. Bacteria and viruses, okay, yes, of course, if we're looking at basic cell biology, but not at a species level with a society. So the only one that really we know that has a lot of similarities to our society is the rat model. So as we do not have human data yet, we use rats because they do tend to form societies, and they also have same sociological rules as humans. What does that mean? That means that they tend to form friendships, they have individuals that they don't really like, they have a specific partner for the rest of their lives. They tend to take good care of their little ones. They are family oriented. So they have the same sociological rules as a general fact as humans. That's why we use rats. Mice are not the same. They're not faithful to their partners, and they actually hate each other no matter what happens. So unfortunately, mice are not very good. Usually people tend to confuse the two, but we're a lot closer sociologically to rats than we are to mice. So here's what we've seen. When we put rats, a small society of rats, in space conditions, in deep space traveling conditions, we can see that just after 7 days, their dopamine gets reduced. So their happy hormone gets reduced. This leads to catatonia just after 14 days, all right? There's a cortical perfusion decrease in 14 days. That means that their brain gets less blood, it's less oxygenated, so everything starts to slow down. Even their pH changes after 14 days. And it's actually crazy that there has been 1 or 2 studies that have looked at the long-term effects of rats, and they end up depressed when we put them in deep space traveling conditions. They stop communicating with their friends. They isolate themselves. There's this withdrawal syndrome, and they end up dying from loneliness. So what we can understand from this model is that there is a big risk for humans mentally going into long-term space travels. Of course, we also need to realize that it's not just about during the mission. It's also about the post-expedition, the post-mission mental health. The stress does not end at landing. Behavioral and mental issues from space continue being. There's this shock of changing roles. Being an astronaut, adapting to some conditions for over 6 months, and then coming back to what you had before, which you lose your awe and the overview effect, but you're back to your everyday small problems, right? Actually, Christina Koch, another astronaut, she said that at this particular time, you just have to start letting go. It's time to move on, and you can't hold on to the role you had. So don't even try. Instead, take comfort in knowing that you did a good job and that it's time to go home. All right, another important concept is talking about what is the ideal number of a crew size. So what do you think is an ideal crew size? 1 person, 2 people, 3 people, 4 people, or the more the merrier? So use the chat, please. Okay. 4 people, the more the merrier. 5 people, that's not even an option, but good try. Okay, 4 people. Okay, a lot of people are saying 4 people. A lot of people are saying the more the merrier. All right, great. Well done, you guys. Great. So proud of my team. All right, so let's talk about crew size. It's so interesting. There was this 2005 study that they recorded that there are deviance rates that are very high for crews of 3. What does it mean, deviance rate? Let me give you some examples. So they noticed that there was bizarre behavior like withdrawal, acts of violence, either verbal or physical, or even acts of deliberation, such as hoarding resources. Because you need to realize that the manned mission that goes up to the ISS, for example, does not also carry necessarily cargo. It just almost always just carries the people, the astronauts. However, there are other cargo ships that will come in between missions, for example, that will be filled with food and or other like blankets or whatever, resources in general. And some astronauts had the tendency of picking out, for example, I love chocolate, so I'm going to pick out all the chocolate so that and I'll keep it in my own bedroom, and this way nobody else can have chocolate. I can totally see myself doing that, by the way. But of course, team. Okay. So this is what happened with crews of 3. However, the same study noted that when the crew size increases to 4, there's an apparent significant decrease in the amount of such behavior, all right? So it's actually very interesting to think that by just increasing by one person, the difference in the team behavior is huge, all right? So how do we choose a crew? How does NASA choose their crew? Personality tests, all right? You need to find traits. That means that I need within a team, I need somebody who is a peacemaker, somebody who knows how to face conflict, somebody who is a leader, has this strong behavior. So within a team, you need several different personalities, all right? They need to be independent, but also super important, able to collaborate well with others, right? Because it's about the team. They need to be able to handle conflict well, because while they're up there with their colleagues, you know, you spend the entire day for such a long period of time in such a confined space that you're gonna bicker eventually. So you need to be able to handle that well. Of course, deal well with space conditions like radiation that we talked about earlier. Don't have a problem with extended periods of time in confined spaces, obviously. Of course, they need to pass both their physical and psychological exams, but above all else, they need to be team players. They need to know how to be part of a team. That is the most important part of choosing an astronaut in the part of the psychological exam. So to conclude, space conditions are a challenge for psychiatry. We need to incorporate more psychologists and more psychiatrists into this game, conduct more studies and obtain more results because we have very little data until now. We need to perform personality tests to select the crew, stress the importance of the psychological interview during NASA. There have been several cases reported of astronauts that, despite the fact that it was too late, they were still flown into space because nobody else was available, but they had caused problems and tension, and it is a very awkward situation for NASA when they have trained you, you are ready to go, and you are causing problems, basically. So we can talk about the psychological interview during the discussion if you're interested in knowing more details. We have a lot of rumors about how it goes. Nobody really knows, but there's a lot of rumors about that part of the interview. All right, thank you very much.